You can run a marathon, have normal cholesterol, and feel completely healthy while dangerous plaque grows silently inside a coronary artery. That sounds impossible, but it's one reason why, for many people, the first symptom of heart disease is a major cardiac event rather than warning pain. The problem is not that your body ignores disease. The problem is that your arteries are extremely good at hiding it. Most people imagine plaque like grease clogging a pipe, but that's not how coronary disease usually develops. Your arteries are living tissue. Over years, things like high blood pressure, smoking, elevated blood sugar, and ApoB-containing cholesterol particles damage the inner lining. Your immune system responds, cholesterol gets trapped in the wall, inflammation builds, and plaque slowly forms. Here's the critical detail. In a landmark study by Glagov and colleagues in 1987, researchers showed that arteries can actually stretch outward as plaque grows. This is called positive remodeling. Instead of immediately narrowing blood flow, the artery wall expands to preserve the opening in the center. So someone can carry substantial plaque while still having normal blood flow and zero symptoms. That's why a fit person can run a 10K and still have underlying coronary disease. Symptoms often do not appear until narrowing becomes severe, but even that is not the most dangerous part. The biggest misconception about heart attacks is that they happen because an artery slowly closes off. In reality, many heart attacks come from plaques that were less than 50% blocked beforehand. The danger is not just plaque size, it's plaque stability. Think of plaque like a blister with a thin cap covering soft inflammatory material. If that cap tears during a blood pressure spike or intense exertion, your body reacts instantly. Platelets rush in to form a clot. That response is life-saving on your skin and catastrophic inside a coronary artery. The clot can suddenly stop blood flow within minutes. The Prospect trial by Stone and colleagues in 2011 showed that future cardiac events often came from plaques that did not look severely obstructive beforehand. Smaller, unstable plaques can be more dangerous than large, stable, calcified ones. There's another pathway people rarely hear about. Sometimes the heart can be injured without a new clot at all. During intense exercise, heart rate and oxygen demand rise sharply. If a moderate blockage limits supply, the heart muscle may not get enough oxygen even without plaque rupture. Add dehydration, illness, stimulants, or an arrhythmia like atrial fibrillation, and the mismatch becomes worse. This is called a type 2 myocardial infarction. Now, the hopeful part. Your heart can build backup circulation. As arteries narrow gradually, tiny connecting vessels called collateral arteries can grow and reroute blood around blockages. Exercise strongly stimulates this adaptation. A 2020 review in Circulation confirmed that regular cardiovascular training promotes collateral vessel development and improves coronary resilience. This is also why exercise still matters enormously. The goal is not perfect arteries. The goal is a stronger, more resilient cardiovascular system. Screening matters because symptoms are unreliable. Standard blood work tells you what is circulating in your blood, not what is already embedded in your artery walls. A coronary calcium score, or CAC scan, is a low-radiation CT scan that measures calcified plaque directly. The MESA study by Detrano and colleagues in 2008 showed CAC strongly predicts future cardiovascular risk. A 2025 BMJ Open systematic review confirmed that risk rises dramatically as CAC scores increase. So the practical protocol is simple. Train consistently with conversational pace cardio plus occasional intervals. Eat a Mediterranean-style diet rich in olive oil, fiber, vegetables, and omega-3 rich fish, supported by evidence from the Predimed trial in 2013. Manage blood sugar and blood pressure aggressively. And if you are over 40 or have a strong family history, discuss CAC screening with your physician. This video is for educational purposes only and does not constitute medical advice, diagnosis, or treatment. always consult a qualified healthcare professional regarding your health and screening decisions. Follow for more evidence-based health breakdowns. Like, subscribe, and share this with someone who thinks feeling fine means no risk.